Well, hi, it's Dr. Chad here at Revelation Chiropractic. I just wanted to take some time to go over one of the most important assessments that we do in the office is actually to see exactly what the structure in the spine looks like before we start care in our office. So when I played football in college, they filmed everything, and it was really frustrating sometimes when you were not where you should have been. But then I also understood why I wasn't there to make the play in that particular situation. So they said all the time, the eye in the sky never lies, and all that meant was whatever that film showed is where you either were out of the proper position to make the play or you were in the right position and therefore you made the play. So when we take x-rays, it's really important, it's critical to understand why you're having the issues that you're having, and that really becomes crystal clear when we look at the structural things that go on in someone that comes into our office. So we're going to walk you through step by step what we look for and even give you some explanations as to how long potentially that problem could have been there. So the x-rays that we're going to look at today are from someone that's just a few years older than me, so 37, 38 years old. But we're actually looking at the side view of this person's neck. So one of the biggest things that we're really big on is posture. And so if your head continues to do this over a long period of time, there's several things that we'll see on an x-ray very quickly as soon as that x-ray pops up. We'll start to see, instead of a curvature that's like a banana shaped that's going in this direction, we'll start either seeing a straight neck, or even worse would be like a reverse curve in the neck. And so there's a lot of research on the tension and the stress that happens from an abnormal curvature in the neck, but that's your God-given shock absorber. So every single day when you're twisting and turning and working at a computer, if you have a curvature, that gives you some extra support as you go throughout your day in, day out life. When you lose this curvature, that is going to compress and squeeze on those discs and joints even more, creating more nerve interference that's going to limit the way your body adapts and heals. So on this x-ray, you can see this neck is straight up and down. And the next thing we look for are the disc spaces all equal as far as how thick they are. Because as soon as you start coming down in this neck, this person's disc right here is 50%, maybe even less of what it should have been. And over the course of time, what the body actually starts to do is it'll actually produce these fingernail type projections, and that's called a bone spur. And when you look at orthopedic research, the degeneration that happens, whether it's in your spine, in your hip, or your knees, the research says that's a minimum of 10 to 15 years of wear and tear on a joint before it ever can show up on an x-ray. So most people, when they go in to see a doctor, whether it's a chiropractor or their primary care physician, they'll go in once they have a symptom. So the scary part about this is this individual actually had no significant neck pain, no significant day in, day out discomfort, but there was significant degeneration and bone spur formation in the neck. So what does that tell you? That means your body can actually deal really well with a lot of dysfunction. And a lot of the research shows that it's 70 to 80% of the nerve has to be compromised before it ever exhibits a symptom. And so the body is trying really hard to deal with a lot of the structural damage that's going on. So like we talked about earlier, when we first start care, we go over that the body only heals from above, down, inside, and out. And this structural damage limits the body's ability to heal because that interference interferes with the nerve pressure. That structural problem interferes with the nerve damage there. So this is the biggest thing that we look for is, do you have a curve or do you not have a curve? And the disc spacing needs to be symmetrical throughout that section of the spine. And if not, that's arthritis. And that problem isn't a month old or a week old when you first had the symptom. It actually was in there a lot longer than what you think. So on a side view x-ray, that's the biggest things that we're looking for. And so the nerves in the neck, these nerves go to your thyroid, the nerves go into your shoulder and can create numbness and tingling all the way down into the hands. And the nerves up here in the upper neck, because of that lack of curvature, you have a higher risk of having neck or headaches, sinus issues, because of the nerves in this upper neck actually create either a healthier blood supply to the head, or if it's diminished, that can create a lot of the headaches. So that's one of the most critical x-rays that we see in our office, because this is where most people's issues start from. The upper neck area is the most mobile area of the spine, but it's also the easiest to go out of alignment. So the next x-ray that we'll show you is totally different rules, but it's the front to back view. And the front to back view is where we're going to be looking for things like scoliosis. So scoliosis is one of the most important things people don't even realize that they have. It's almost like so many of you may have had a cavity before and you go to the dentist, but you didn't know you had one. It doesn't hurt. You don't feel it day in, day out. But they tell you, oh, well, you have a cavity. We need to do something about this. Well, no one would ignore the dentist's recommendations and not get the cavity filled. They want to take care of it, even if it's asymptomatic. So scoliosis is probably the most asymptomatic thing that we see. They don't maybe have back pain or discomfort there. But when we have a scoliosis, what I usually do on an x-ray is I'll draw a perfect vertical line that would show you where normal is, and a lot of times we'll see these scoliosis going left to right. So as you can see, this deviation to the right, you could probably guess which side is going to have more issues. So most people would look at that and say, oh, it goes to the right. It would have more issues on the right, and this person has significant sciatic and hip and low back issues on their right side. So when we see scoliosis, you could even see the pelvic bones here. Ideally, they would be perfectly symmetrical, and a lot of times what happens is that pelvis or that sacrum dips on that side, and that creates more wear and tear and more stress on that lower side. So if you look at a foundation problem in a house, there's going to be settling in one area of the house, and then above it there's going to be symptoms, maybe cracking in the walls, or you may see some separation there within the joints of the drywall. The same thing in the body, the pelvis, the lower it goes, the more there's going to be wear and tear and nerve pressure on that side. So this, just like with the side view of the neck, these abnormal curvatures, the research is showing that actually decreases the action potential of the nerve. Action potential meaning your nerve should travel at the speed of 260 miles an hour. And with having abnormal curvatures like this, that can slow that down 70 to 80%. And when we look at that, that is why people don't heal or bounce back or adapt as well as we get older. And it's not because of age, it's because we have these abnormal structural problems or degenerative changes in the spine that are limiting how well you're actually able to heal. And everything with chiropractic is helping your body heal, because right now as you're watching this, your body is breaking down and your body is healing. And if breaking down is winning over healing, guess what? You have these symptoms, these aches and pains, this dysfunction in your body. Whereas our goal is if we can correct the structure, it helps your body adapt and function better, and then healing can win over breakdown. And that's when your body is at the peak potential that it can be, is when healing is winning over breakdown. And so the longer that this scoliosis stays there, or the longer that your neck curve isn't where it should be, do you think it just randomly gets better? Of course not. We have to take action in relation to our health. So when we see this problem just continues to get worse. The body can build bone spurs, there can be degeneration, or the disc is going to be compressed worse on one side more than the other. And the longer that that's there, the worse that's going to get. So if you ask your dentist, hey, if I don't get this cavity filled, what's going to happen? Well, that cavity could end up rotting the tooth. It could end up getting into an infection in the tooth, going in the nerve, going to your brain. And so no one would ever question like getting a cavity filled or having a root canal. One of the biggest things we focus on is if this isn't corrected, you only get one spine. You have to take care of the structure that you have. If you have a bad tooth, they can remove it, give you a new one, and it's actually pretty easy to do that. With the spine, the research with structural degeneration, where someone needs to have spinal surgery, the research is about 80 to 90% of those surgeries, within 5 years, those patients are the same or worse as they were before the surgery. So we have a thing here, so we say, have you ever heard of a spine transplant? I haven't either. And so we only get one good shot at this with our spine, and we want to take the best possible care of it as we can. And chiropractic is one of the most critical parts of your health, because the nature of how well your structure of your spine is can tell me how well your body is functioning. If your structure is normal, your function should be normal. But if your structure is abnormal, and it's been abnormal for a long time, you're going to have at some point, and in some different degrees, some dysfunction. So the other big thing with scoliosis in the low back is that the nerves in this pelvic area, this is so common in women, but the nerves in that low back actually control the reproductive organs of both males and females. But what we see is I've never seen a female in the office that had very significant painful menstrual cycles or ovarian cyst, whether that's PCOS or uterine fibroids, that did not have a significant scoliosis in their low back. So there is a direct correlation. I challenge you, look at any Gray's Anatomy textbook, any neurological drawing of where the nerves go. The nerves in this region have a direct control over the reproductive organs and digestive organs in that pelvis and lower back. So one of the things that people don't realize is, well, I'm here for my low back pain or my sciatic issues. I understand that's a big concern of yours, but I would argue that the organ function is infinitely more important than just the everyday aches and pains. And so in our office, I think you'll find that we don't just try to help someone with the aches and the pains, but we need to have correction of the way that the structure may be degenerating over time. There may be breakdown, and the goal is, if your neck or if your low back is in an area like this where there's arthritis, or you've been told that you have arthritis, the good news is there's hope, because we have seen time after time that not just the person feels better, but that the curvature and the disc space actually heals to where the body, the neck would be totally normal, or the low back can be totally normal. So what we always tell people is it's never too late to get adjusted and to start taking care of your spine, because the sooner we start getting this adjusted, the faster we can stop degeneration from continuing. And then the body, once that degeneration has stopped progressing, it can actually start to heal just like you're intended to heal. You're designed to live to be 110 to 120 years. Not many people want to live that long because sometimes they have these aches and pains. But the goal of this is that you can live the life that you were created to have by taking care of the structure that is imperative for how healthy and how well you function. So Dr. Chad here, we're looking forward to doing more videos like this, just so you can get an understanding of how our office operates, but also get to know us, see us, and then that way if you come into our office, everything will be pretty crystal clear, and it's almost like you get to meet us before you come in. So I hope you have a great day, and look forward to seeing you on the next video.